Hi, everyone. My name is Shaheena, and I'll be the moderator this session. I'm a clinical psychologist and a member of the Community Counseling Services, CCS. CCS is a committee under the umbrella of the Aga Khan Social Welfare Board. It is comprised of several volunteers, psychologists who have a background in mental health. The CCS offices are located above the pavilion at the Parklands Jamaat Khana, offering mental health services, including counseling sessions for members of the community. During this time, sessions are conducted via phone, WhatsApp, or Zoom. Please reach out to the CCS numbers on your screen whenever the need arises, as we are here for you. Earlier this month, we provided the community an opportunity to ask some questions that they have regarding substance use and don't know where to ask or aren't getting any clear answers. We have compiled all the questions asked, and I'll be asking each one of you based on the type and context of the question. At this time, let us go around and introduce ourselves. Judy, could you start us off, please?
Good evening, colleagues. My name is Judy Twala. I am currently the manager in charge of counseling and rehabilitation at NACADA. I am also a certified counselor's supervisor. Thank you. Over to you, Shaheena.
Thank you, Judy. Welcome. Dr. Mburu, can you tell us a little bit about yourself?
Okay, thank you very much. My name is Dr. John Mburu. I'm a trained psychiatrist. Currently, I'm a lecturer in the Department of Psychiatry of the University of Nairobi, and I'm also involved in the area of mental health in many other places. I'm interested in the area of addiction as part of my clinical work.
Thank you, Dr. Mburu. Farid, glad to have you on board. Could you please introduce yourself?
My name is Farid Khimani. I am a radio presenter, a mental health advocate, and I'm also in recovery from addiction.
Thank you, Farid. Last but not least, Zaini, can you please tell us a little bit about yourself?
Hi, my name is Zainat Mohamed, more commonly known as Zaini. I'm actually the national board member at the Social Welfare Board, and I have dabbled in the substance use arena from time to time, and I'm happy to be here.
Thank you, Zaini. I'd like to welcome all of you to our webinar for today. We have many concerned parents that have submitted questions, and we'll be looking forward to your responses to their questions. If we could begin with Dr. Mburu, as someone who's directly involved in the treatment response, one of the questions that has been asked on many occasions is, how can I tell if my child is using drugs? Is there anything in particular to look out for? Any behavioral changes?
Thank you for that question. Every parent is very much concerned about their children's welfare. They know how best their children behave most of the time. One of the indicators that there is a change, or maybe they're using substances, is when they deviate from the expected behavior. They'll probably isolate themselves. They probably keep wrong companies. They may probably request more money than necessary for the purpose of funding their behavior. The effect of drugs on their mind, because most of the substances are mind altering, will be very evident. When they don't have the substance in them, they may probably become very irritated. They may show depressive feelings, depending on whether they take depressants or stimulants. Over time, their behavior changes, their performance changes. They may start skipping classes, keeping the wrong company, and you will, as a parent, be able to notice that there's something that has happened to this child which was not previously there. Sometimes you may also discover the substances on them, maybe leftovers of cigarettes or some containers with alcohol, or sometimes some syringes that they keep if they are doing intravenous use of substances. So the most important thing to look for is drastic change in behavior and performance in areas that they previously did very well.
What about for
Good.
adults? We have a question on how can you tell if you're becoming dependent on substances, on alcohol?
Good. For adults, they go through phases. The initial phase is experimentation, where they probably use a drug for the purpose of getting a kick or a high. And as time goes on, they develop what we call tolerance. If they were taking X quantity of a substance, over time, they find that they require 2 units, 3 units to achieve the same psychic effect or the same pleasure effect. So the first thing is loss of control. And as time goes on, they probably have many other observable manifestations. For instance, they spend more time doing nothing else but seeking for their drugs. They may get involved in many other activities, such as even stealing, lying, for the purpose of acquiring that particular substance that they are really interested in. Now, there are many complications that may arise, health complications. As I said at the beginning, these drugs alter the state of the mind. They may induce some mental disorders. They may go into depression. They may get violent. And over many years of using the substance, there'll be many other complications which are social as well as psychological. They may lose their jobs, they may lose friends, they may lose families, and they deteriorate in all areas of functioning as time goes on. So for adults, it might be probably easier because we'll be able to notice those behavioral changes. We may see a lot of change in their performance and so on. So a person who is fully dependent on substances tend to do nothing else but put all his priorities on activities where he'll be able to obtain the substance that he's actually dependent on. There could probably be many other manifestations, but I think tolerance, consuming higher doses of the same substance, all the priorities are directed towards obtaining that particular substance, getting involved in any activity that will ensure that they get a substance, including criminal activities. This may be very obvious, signs and symptoms seen in communities. Now, as I said a little bit earlier, they may develop what we call substance-induced mental health disorders. For instance, delirium, total confusion that may require admission into hospitals and detox. They may develop other psychotic behaviors that may present like real mental disorders. Of course, they are mental disorders, but we know they are drug-induced. And when they get into that stage, then it's time to take action, maybe have them rehabilitated and managed for any complications that they may have out of use of their substance. For instance, this case, alcohol, which causes a lot of damages to many other organs of the body, the liver, the pancreas, and so on. So the health deteriorates over time apart from the behavior in adults.
Thank you, Dr. Mburu, for that. We can go over to Judy. Judy, we understand that NACADA implements life skills interventions. How can we apply some of these techniques in the home environment?
Thank you very much, Shaheena, for that very good, well thought of question. Yes, it is true NACADA implements life skills interventions, and how we can apply some of these techniques in the home environment is by we as caregivers, parents, guardians, acquiring the life skills themselves. For example, we train our children how to manage their anger. So if we as parents, as the role models, do not have the skills of anger management, it will be impossible for us to pass the same to our children. We can also teach our children social skills like interpersonal skills, simple acts or skills like turn taking in conversations so that our kids can know when daddy is talking, you listen, you wait until he finishes, and then now you can speak after he has spoken. Skills like drug resistance skills, teaching our kids to say no and to remain firm to what they say, refusal skills, so that they already know the effects of drugs and they have the ability to say no to peer pressure. Skills like coping skills. Currently, we are all focusing on mental health issues. Suicide and homicides have risen globally. So we need to teach our children as young as even 4 years old to learn how to cope with stress, little stress, like lack of a broken pencil. That's a stress. So we can teach our kids how to address such small stresses so that even as they grow up, they already have acquired coping skills to manage stressful situations.
What about screening? I think that this question is focused more on screening. Do you have any thoughts about screening?
Yes, I do. In regards to drug screening, NACADA recommends drug screening or drug testing as long as the results will not be used as punitive measure. So if you screen a child or an adult or whoever, an employee, a colleague, a friend, and you realize that they are using drugs, it should be used to help them through brief interventions, counseling, and even further referral for outpatient rehabilitation programs or even inpatient programs. Our concern comes when especially the school administrators expel children from schools after screening them and finding that they are positive for drug use. So what we are advocating for as the government is that if you screen a child in school and you find that they are positive for drug use, you should refer them to available interventions other than expelling them. Because once you expel them, they get admitted to another school. You are transferring a challenge from one school to the other school, and we will not have helped the pupils. So we need to screen for supportive reasons. Over to Shaheena.
Thank you, Judy. That's really an important point that we need to put out there. Over to Farid. Farid, you shared your journey recently, and we applaud you for your bravery on sharing your experience. What do you think is the right approach in this situation?
If we're talking about, the shared experience, for me, it was more to use the platform I have, because I'm not in a clinical space. I'm not in a counselor kind of capacity, but to use the platform I have so that, I felt and was encouraged to use that platform based on the fact that there would be a number of young individuals that could identify with me as someone they know, maybe in the media space, and, also even people that I know personally as well. So that approach really was, unique to me. I'm not sure if it's the right approach or the wrong approach. I've said this before. My mom was initially very apprehensive of me doing that, but the beauty of me doing that is that it turned from embarrassment into pride when she started receiving feedback from people she knows, saying that they were very, very happy and proud that I had done it. So look, I think that everyone's journey is individual. Everyone's journey is unique to them. But I just felt like I could use my platform to help a younger generation to not only identify that yes, they may have a problem, and also that there is actually a solution to the problem, and that's recovery.
Okay, thanks Farid. We'll go over to Zaini. Zaini, as a person in the community whom many look for guidance, how serious is the council taking issues of alcohol and substance use, and what is the short and long-term plan?
Okay, our council actually takes this to come forward for guidance and help in this area. Then support is extended in terms of provision of the right personnel, and the therapists then will work together with the member, community counselling services. In the short term, plans are made for support groups, one-to-one counselling, or it could be in group meeting sessions. And the long-term planning would involve options open or treating them whilst they're at home. Long-term plans would also involve the SMART goals. For example, the SMART goals: specific, measurable, achievable, realistic, and time-bound. So all that is put together in the long term, and they do follow up with this treatment.
Thank you, Zaini. Back to Judy. Judy, this question is for you. As a professional that works at the policy level, can you tell us a little bit about the situation of drug use in Kenya?
Thank you very much, Shaheena. The situation of drug abuse in the country is a bit worrying. And I would want to refer to a secondary school survey that was done in 2016. And after the survey, we realized that our kids, when they are joining Form 1, they have already started experimenting with drugs or substances, either a substance of tobacco, alcohol, miraa, or prescription drugs. And this now pushed NACADA to do a survey in the primary school, because if a child joining Form 1 has already experimented with alcohol, we wanted to find out where does it begin. And we did a survey on primary schools in 2019, and the findings were worrying, because we discovered that 16.9% of primary school pupils are currently using at least one drug or substance of abuse. That's a bit worrying. It's a bit worrying, and this led to the development of national school guidelines, which were launched a few weeks ago, which gives the schools, school administrators and the Ministry of Education wisdom on how to address alcohol and drug abuse within the schools, among the staff, the school workers, and even the pupils and students themselves. The survey that was done in 2017 for substance use disorders was also worrying, because we realized that 10.4% of Kenyans have alcohol use disorders. That is high, 10.4%. And then for tobacco, we had 6.8%. For cat, miraa, we had 3.1%. For cannabis, we had 0.8%. For heroin, we had 0.4%. And for inhalants, we had 0.3%. So the situation is dire, and that is why we are calling upon all key stakeholders to join hands with NACADA and all government ministries to address the issue of alcohol and drug abuse in the country. Over to Shaheena.
Thank you, Judy. Farid, one of the questions is, can the use of drugs and alcohol be a direct consequence of someone going through anxiety or depression? And what can a person as a close friend do to help this person?
I think, we, and as Judy has just mentioned, the numbers are quite staggering. So, we are in many of our communities, there's a lot of drug and alcohol abuse. I've seen it with my own eyes, and I can speak again for myself when I say I suffer from anxiety and paranoia, and it definitely worsened over the years, with or without the substances, but the substances give you a temporary relief. And so therefore, sometimes that's the relief you need. But obviously when you are coming down from the substance, or in my case, when I was coming down from the substance, it would be, exponentially higher, the anxiety and the paranoia as well. So I've experienced that. I've experienced, since I've been in recovery, a different side of living, and that is really truly a living in a world without much fear. And I think that's a huge step to realize, and really a positive step in that regard. When you get to that place, post addiction, or rather in recovery. As far as close friends and family members go, you know, I've had this discussion so many times with parents who have reached out to me. And again, I don't want to ever come at anyone from a clinical perspective, but I can only say that someone really has to want to get better in order to get better. And that's really the tough part about this whole addiction recovery thing. Many parents who meet me or friends of people in addiction who meet me will often use my example as their case study. But I was at a point where I was 100% ready to get better. You know, going back about 3.5, almost 4 years ago. But I'm not sure anyone could have had a conversation with me. And this is not to discourage anyone, so I'm just giving you my story here. Could have had a conversation with me prior to me, you know, deciding at one point that, you know, enough is enough. There obviously are sometimes situations, and I would imagine some of the other panelists can probably, you know, lean in here, where you have to really take control. I assume as a parent, it's of a young person, someone in their youth, teenager, 20s, early 30s. I would assume a little bit of you know, I don't want to say force, but maybe that's the right word. Force would have to be put into play if you're seeing, you know, the signs that the doctor mentioned in the first question. You know, the mood swings, the shift in behavior, stealing, lying, etc. Then I do think there has to be some sort of force is such a terrible word, but I can't think of another one. You know, forced approach to helping someone get better, and sometimes that's probably not going to be very easy or very comfortable for a parent or for the person who's in addiction.
Okay. Zaini, one of the questions asked is on the rampant consumption of pan barag or masala in the community. What are your thoughts on this?
Okay, first let's Asian communities, but not limited to it. And pan barag is made up of the following combinations: betel nut, cardamom, lime, which is calcium oxide, and techu, which is vegetable, menthol, clove, and natural fragrances. So all these things combined come in a little packet and is termed as pan barag. Among humans, very leading cause that often progresses to oral cancer is developed from consumption of pan barag. Especially prolonged use of all organ systems. And there is immediate need for calling out a complete ban on this substance. In fact, in India, they've already started the paperwork to ban this substance, be carcinogenic. Over to you, Shaheena.
Thank you. That insight on pan barag. Dr. Mburu, there's a lot of information on support to stop cigarettes. What can you recommend supporting someone who wants to quit the mawa, which is a mixture of thin shavings of areca nut with some tobacco flakes and slaked lime? And what are the long-term consequences of its use?
Sorry, are you talking to me? Because it's on and off my Wi-Fi.
No, Dr. Mburu.
Okay.
Dr. Mburu, can you hear me? Okay, we can go over to Judy for the next question, and then we'll get Dr. Mburu to respond a little later.
Can you hear me now?
There. Oh, yes, we can hear you.
Okay, good. I've heard your question, and let me say this.
Yeah.
We in the clinical area, and especially in my area as a psychiatrist, are more likely to see those substances that are recognized from a medical point of view. But now what you're asking me are some conclusions that I may not have a lot of experience about them, but what you're asking is smoking. Let's talk about smoking in general.
Sure, sure.
Yes. I think smoking is one of the most commonest addiction that we have around. And tobacco per se is what is probably known as the main ingredient in most of the substances that are smoked. I had you mention others, which I'm not very sure about. But what you're asking is, what should we do to people with, addiction to substances that are smoked? I have experience with nicotine, and there are some drugs that we give, for example, that minimize the cravings. The other thing that we usually do is to give them substances which don't contain so many other tobacco per se itself contains so many ingredients. And I had somebody mention about carcinogenic, cancer-causing substances. So if you can get a substance that contains nicotine per se, and then you give a regulated doses, 4 milligrams, 8 milligrams, and so on, in limited quantities, maybe you can be able to deal with addiction to nicotine. Plus, of course, the other pharmacological agents that I talked about, like Zyban. But I can tell you, to get people off smoking is not a very easy task, just like it is for other substances like alcohol. But then we don't give up. We continue working with them, and they are addicted to many, and addictions are there to many other substances, some of them even worse than tobacco and alcohol, for instance, the narcotics. And of course, there are procedures on how to deal with the detoxification of such particular people in clinical settings. I listened to Farid as a recovering addict and so on, and he talked about self-medication. Most people use substances to take away their anxiety. For instance, there are people who would not be able to start a day until they've smoked a cigarette to calm their nerves. What we probably recommend in clinical situations is to determine whether there are comorbidities. In other words, are there any other psychiatric or psychological illnesses that the person is trying to manage using drugs of addiction? We on most occasions find that there is comorbidity. When you find one is addicted to one particular substance, alcohol, heroin, codeine, or any other of those addictive substances, there's a high chance that they also have maybe an existing or pre-existing psychiatric disorder. And managing those disorders in the first place will probably minimize the risk of continued use of psychoactive substances or drugs of addiction. So in terms of helping these people, you need to assess them, determine whether there is comorbid psychiatric or psychological illness, and address it. And sometimes you do pretty well. I think at the community level, Farid has talked, and I'm very happy about what he said. Having been there, he can now be able to counsel other people not to get where he was. And we should do this for all drugs, whether it's alcohol, nicotine, and other substance, narcotics, and so on. Like I said at the beginning, it's not very easy to deal with people who have got addiction, but is a war that should be continued over and over again.
Okay, thank you. Thank you, Dr. Mburu, for that. The next question, Judy, this is for you. Whenever there is a cry for help, we are worried that trying to get the person help will result in them getting in trouble. What do I do to help someone receive help in a supportive and non-punitive way? What are the steps, and will they be protected?
Thank you very much, Shaheena, for that question. And it's very unfortunate that addiction management has been stigmatized. There's so much stigma surrounding drug addiction. Hence, many people will not disclose that they are struggling with substance use disorders. And I want to call upon everybody listening to us today to come out and advocate for persons with substance use disorders. WHO has classified addiction as a disease, and it is only fair that we treat persons with substance use disorders with the dignity they deserve, with the empathy they deserve, and we should accord them unconditional positive regard. Just like we treat cancer patients, hypertensive patients, diabetic patients without discrimination, the same way we need to treat this very vulnerable population of persons with substance use disorders. How do we support them without being punitive? One is by understanding that addiction is a disease. If we do not understand that addiction is a disease, we will continue stigmatizing them. We will continue taking addiction as a moral issue. Hence, we will not even care what happens to these people. Addiction is a family disease. When someone is in active addiction, they wrong almost everybody that comes their way. They take things to sell so that they can acquire their substance of use. They argue, they break relationships, they quarrel with even very significant others in their family. So for us to be able to support them, we need to empathize and to understand what they are going through. Remember, people with substance use disorders have serious underlying issues that we need to empathize with. We need to hold their hands and support them through recovery. And I really want to acknowledge Farid here for the efforts to remain sober up to today. You are an encouragement. You are a great champion to other people who are struggling to recover. Keep it up, keep it on. So when we identify addiction as a disease and we reduce stigma, then people will come out and disclose what they are struggling with. The stigma will be reduced. In the school setting, it is very unfortunate that when children are found using drugs, even at the experimentation stage, most of them are expelled. Or even when they are sent home to go for counseling and drug testing, the conditions are very severe. We have already classified these children as criminals or as those who are lacking discipline. That alone is discrimination, such that even by the time the results come out and that child is found to be positive of drug abuse, they have already started feeling guilty. They already feel unwanted. So in such a situation, we cannot be able to support those children. And that's why I'm saying NACADA and other government institutions, faith-based institutions, CBOs, private and public entities need to lobby and to let everybody know that these are sick people that need to be helped. We have available interventions. If you don't know what to do with someone who is struggling with alcohol, tobacco, or any other substance of choice, please call our toll-free number, 1192, and our counselors will assist you any day, any time of the week. Our toll-free helpline runs 24 hours, 7 days a week. Over to Shaheena.
Thank you, Judy. That actually brings me to my next question to you. What if a teacher identifies that a student needs help? First, is it fair to assume that the student needs help, or what should the teacher do if they're not sure?
Thank you very much. If a teacher identifies that a student needs help, we are currently training guidance and counseling teachers on how to identify kids that are abusing or experimenting drugs. So when they are trained and they're able to identify those kids, first, we should remember that it's human to deny. Everybody wants to be the good one. Everybody wants to appear as the most obedient one. And this happens mostly to pupils and students. So we as teachers who are trained need not to be ignorant to the fact that many students will deny. And denying does not exempt them from experimenting from drugs or being positive from the screening that will be done for drug use. So what we need to do as teachers, we need to show that we are ready to help and help assure these children that even if we refer them for outpatient programs or even inpatient programs, we will accept them back to school so that they can continue with their schooling. It is unfortunate, like I said earlier, that some of the school administrators are expelling children from school because they have tested positive for drug use. So we need to understand them. These are our children. We need to embrace them. And the people I have interacted with that have passed SUDs, they tell us that what they desire most, it is to connect with a being, another being, to connect with someone, to connect with something. And when we are not available as teachers, as community, as families, as former colleagues or even colleagues presently, then we force them to continue seeking for that substance of choice to connect with. So the part of connecting is very key. We need to show these people that we empathize with what they are going through, and we are willing to hold their hands through getting the available interventions.
Thank you, Judy, for sharing that. That was very, very useful. We go over to Dr. Mburu. Dr. Mburu, there seems to be a lot of interest on the marijuana debate. What are your thoughts on marijuana, the pros and the cons?
Thank you for that question. Amongst most of the drugs that are, marijuana is probably the most common substance that is abused. Reasons are that it's cheap, it's easy to walk around, and so on. Now, again, marijuana is a plant that contains very many ingredients. Some of them are medically, and it has been said in some countries that they are medically beneficial. But because it contains so many substances, the benefits are fewer. There are more damages than benefits. We tend to find most of the marijuana users developing abnormal behaviors, or maybe drug-induced or marijuana-induced psychotic episodes. So up to now, the debate is big, whether it should be legalized or not. But I think from a medical point of view, we shouldn't. In the hospitals where I worked, most of the young people that we find there with brief psychotic episodes, marijuana is involved. And it's true, it induces some kind of psychotic episodes. In terms of health, I've had the policies that NACADA is putting in place, that we should identify these people rather than punish them, probably rehabilitate them if they are young, adolescents in school and so on. So the issue of marijuana is still very controversial, but I think there are no benefits in using marijuana at all, any benefit medical or otherwise at the moment.
Okay. Dr. Mburu, can it be mixed? So can marijuana be mixed with tobacco and used to help with sleep? And are there long-term consequences for this? And how does someone get help for marijuana?
From my perspective as a doctor, we only need these people because they come to us having developed a psychotic episode or some very aberrant behaviors, right? If people are suffering from conditions like insomnia, there could be very many other causes why people lack sleep. I would recommend that this person seeks a doctor's opinion. There are medically sanctioned substances or drugs that are used for treatment of insomnia and so on. And of course, also find out what is the cause of this insomnia. It could be another medical condition that can be treated with the medicines that are acceptable without any serious side effects and so on. So I think, again, the answer to what you're telling me, treatment of insomnia using marijuana and tobacco, I think it should not be allowed.
Okay. Thank you, Dr. Mburu. The next question goes to Farid. What do you think we can do better as a community to have people who need help reach out to us?
Yeah, that's a great question. But before I answer that, I just want to go back to the previous comments from Mburu, and just share. I was of the opinion for many years using marijuana regularly that it was not damaging, only to find out after extensive use over a long period of time, it actually does have some serious long-term effects that take a long time to get rid of once you stop using it. So I wholeheartedly agree with the last comment. I don't think it has a use that cannot be solved with other medically prescribed and legal methods. Now, going to your question, what we can do more as a community. I think you guys are doing a fantastic job. What I've learned in the short time I've been exposed to the work you guys are doing. I think one of the big challenges we have here is, and I could be wrong, but from what I've seen, and also my journey to a rehab facility in South Africa, having seen a few rehab facilities here in Kenya, is that we don't have the capacity in the rehabilitation centers that they have in different parts of the world. And I think that is a challenge, for addicts recovering that don't have the access to the money and the family support to travel outside of Kenya to a rehab center. I was fortunate enough with my family support to get to South Africa to a rehab center called Bloomendal Addiction Treatment Center. But also, I think, as a community, we have to talk about it. Now, I speak as an Ismaili, and it could be the same in a number of different communities as well. But the sheer embarrassment that surrounds addiction is a problem. It's a problem that we don't talk about it. We don't want our neighbors and friends and people in our mosque to know that our child or children or family members, father, uncle, whoever, are addicts. And therefore, when you kind of sweep things like that under the rug and you don't talk about them, that's a breeding ground for the addiction to ultimately get a lot worse. So we have to talk about it. We have to be open about it. It should not be a conversation children fear to have with their parents, or parents fear to have with their children, or brothers fear to have with their sisters, whatever the case may be. And I think once the stigma is gone, I think Judy mentioned, once we realize that this is a disease, it's a sickness, and it should be treated with the same respect as every other disease and sickness, identify the problem and then seek the proper treatment to help to alleviate the issue.
Okay. Thank you, Farid. There are people listening to this today. What do you think we can do for them at this time, those that are ready to receive the support or not?
Look, those who are ready to receive the support, that is, that's wonderful. I don't think there's much more you can do that you're not doing with the programs that are put in place. I'm speaking to you guys directly. Of course, other communities can learn from that as well. But as I mentioned before, those not willing to seek treatment, it really is tough. And again, from my experience before 2000 and early 2018, I don't think I would have listened. But having said that, I think education is vitally important. But again, I think this also goes back to the previous question and is tied into that as well. Once we lift the stigma, once we start talking about the problem at dinner tables, at churches and mosques and in groups of friends, and parents can speak to other parents. Once that happens, I do believe that they'll put a massive dent in the addiction problem.
That's really powerful. Thanks for sharing, Farid. Over to Zaini. Zaini, there is a question that I think may be best answered by you. Treatment requires rehabilitation and reintegration. How far are the council prepared to commit regarding reintegration? So for example, if I come forward and get help, will you support my treatment? Will you support my counseling sessions? Will you get me a job? These are the common questions that we've received in our panel.
Thank you for that, Shaheena. Yes, absolutely. The council is willing to commit all the way. Now, once the therapy has started up and the client is going through it, we're already getting ready to use another arm of the council, and that is the EPB, which stands for Economic Planning Board. Now, through EPB, we are looking for a job and, of course, ultimate reintegration of the client. So wherever possible, we get the various stakeholders involved. It could be the community therapists, it could be family and friends of the individual. Of course, confidentiality is an important point, and we keep that in the forefront at all times.
Thank you, Zaini.
And yes, and perhaps a client towards the healing process is all important. If they've been coerced or forced into counseling, it won't work well. Chances of terribly on their own. And of course, they are willing to let go of their substance use, Billy Linda, the chances of success are high. So to answer your question, the county, they do offer the therapy, and yes, through seeking for jobs eventually, they do reintegrate the individual back into society.
Thank you for that, Zaini. Over to Dr.
Thank you.
Mburu. We have received the following question. My daughter gets anxiety if she does not get her alcohol. What should I do?
What came first? Was it the anxiety or the use of alcohol? I think the most important thing is let this child be assessed by clinicians, psychologists, doctors, psychiatrists. They'll be able to determine whether this anxiety is a withdrawal symptom or is a basic psychiatric disorder. Remember, we said at the beginning that most people use substances for self-medication. Maybe they have a psychological problem and they have a psychiatric illness, and they don't know how to deal with it. The best way they have learned is use of substances that are going to alter their states of, minds and feelings. So, yes, if the person suffers from anxiety, let that person be assessed by experts in mental health and determine whether this is a withdrawal symptom or it's an existing inbuilt anxiety disorder. Because, as I said at some point, anxiety, depression, and many other psychiatric disorders, they can be managed through prescription medications that are not illegal, that are probably well dosed to avoid causing other side effects. So this person or this child or this daughter should probably be assessed by professionals to determine was actually an existing anxiety disorder. So that's my best opinion at this particular moment for that particular.
Okay, further to that, Dr. Mburu, the question goes ahead and asks, is there any holistic way of helping my daughter besides rehabilitation services?
I think Farid has just mentioned the many ways in which you can help this person. Rehabilitation is one, but in the rehabilitation programs, and maybe Farid, with the due respect, we have a number of good rehabilitation centers in Nairobi, which approach the management at the biological level, that is maybe treat the existing comorbid disorders like anxiety, depression, and so on. The psychosocial support, where counseling to families, as well as the index case is done. And of course, the social interventions, protecting their work, their jobs, because on most occasions, and I think that's why people will not accept, they'll deny their addiction, because the moment the employer gets to know that these people are addicted, then the stigma that is associated with this is so huge that some of them tend to lose jobs and so on. So the rehabilitation is not just isolating these people in a controlled environment. There's a lot of impacting new skills on how to cope in an environment which is very, very risky, because drugs are there, but then new skills must be with the person who is addicted so that they can be able to fit in that environment. So there are quite a number of interventions that are done in rehabilitation to help these people acquire new skills to deal with their problems. Right? They do, and I think NACADA has done a good job. It has listed all the accredited, rehabilitation centers. And I know they usually do visitations to find out how well these rehabilitation centers are doing their mandate. They're carrying out their mandate. So let's say this: there's help. It can be done even here locally. Good. Over to you.
Thank you. Farid, you did mention about anxiety and alcohol, but maybe if you could just tell us in a few words to wrap up that topic, and then we can talk about relapse and what your honest thoughts about relapse are.
Yeah, I mean, I think, we've kind of all echoed the same opinion about anxiety and alcohol. I used it to cure the anxiety, but it's exponentially worse the next day. So I do believe 100% there's a direct correlation between anxiety and alcohol use for sure. Moving on to relapses, they're common. What I learned in rehab was the success rate is less than 30%. And when I say success, it's not really a black and white equation. Success being that you will very rarely find an addict come out of rehab that will never use again, be it drugs or alcohol. The desire to stop using is what keeps an addict on the path of recovery. There are slips. I've had 2 or 3 over the years, nothing major, but I have had a few. I always say this to young addicts that I talk to, that a relapse is not the end of the world. They should look at it as a chance to start again. And that's vital in addiction. That, and this is more from a spiritual perspective, but every night when I go to bed or every morning when I wake up, I do thank my higher power that I managed to stay sober for one more day. And I really think taking it a day at a time is really important in recovery. Because when you start looking at, other people in recovery that have been sober for 10, 12, 15, 20 years, it becomes very hard to imagine getting to that point. So it's really important to avoid relapses or to minimize relapses, to take your recovery a day at a time.
Okay, thank you. Zaini, please help us understand the relationship between mental health and addiction.
Abusing substances such as marijuana or meth.
Sorry, Zaini. Okay, I think we lost her there. We'll just go to the next question. If we can go to Judy again. Judy, there is a perception that NACADA is a body to report drug and alcohol use to. Can you tell us how NACADA is in fact supporting the community to help us and not harm us?
Thank you very much, Shaheena. I would like to gladly and proudly say that NACADA is a friend to the community, because NACADA is interested in the health and safety of every citizen, including our children. And that is why NACADA has worked with the Ministry of Education to incorporate issues to do with alcohol and drug abuse in the curriculum. We are also mandated to provide public education and advocacy in regards to alcohol and drug abuse, ensuring that all citizens in Kenya are aware of effects of alcohol and drug abuse. They are also aware of any emerging trends in regards to consumption, marketing, and trafficking of drugs in the country. NACADA is also doing media advocacy campaigns to sensitize Kenyans on issues to do with alcohol and drug abuse. We are also using the local vernacular radio stations to speak to the Kenyans who are in the grassroots in all counties, using all languages in the country to make sure that every citizen is informed on issues to do with alcohol and drug abuse. We are also developing policies and guidelines that will prevent the youth, the children, from the effects and the traps of alcohol and drug abuse. I would want to refer to the Adika law, which is commonly known as the Motudho law, which has stated that we cannot have a liquor outlet 300 meters to a school or in a residential area. So we as a NACADA have developed these laws and policies, and it is our responsibility as the public to raise our voices if we find some outlets near the schools or in our residential areas, because this is the only way we can be able to address access to alcohol and drug abuse among our children and students. So NACADA is a friend to the community. Thank you, Shaheena.
Thank you, Judy. Dr. Mburu, we have a question that's very specific. It's almost like we're getting a free consultation from you. If someone has a full recovery from alcohol use, but then many years later turns to cough syrup, can they get episodes of psychosis or hallucinations?
The cough syrup contains codeine, and this is a drug that people can get addicted to. I did not precisely get what the question is. Somebody has recovered from alcohol addiction, and then they've graduated into something else like cough syrup, yeah? So what's the question now?
Yes.
What's
so
the
can
question?
they get episodes of psychosis? So after they've gone back to a substance like codeine, can they get episodes of psychosis or hallucinations?
In my experience, codeine is not very much associated with hallucinations and so on. But of course, it's not a good substance to get addicted to. And especially, I know people who will secretly buy bottles and bottles of cough syrups, swallow them like they're drinking water. But of course, anything in excess is likely to produce some side effects. They may get excessively elated, right? And appear like the manic episodes. So basically, all prescription medication should be taken in doses that are prescribed, because we know anything in excess may have some side effects. Okay. The question of really getting into psychotic episodes, that is a bit rare. If it was, then the possibilities of this codeine must probably have been mixed with something else. Like Farid said, relapses are very possible. And maybe they may claim they are just on codeine or cough syrup, but maybe there's something else that they are mixing with that is likely to produce a psychotic episodes.
Okay. Dr. Mburu, what about someone who's under the influence of alcohol, but is talking to themselves and using abusive language? What is the next course of action for this family member?
Now, remember, intoxication is probably very temporary, but then this can progress further into psychotic episodes, right? They could be talking to themselves, maybe they're experiencing some hallucinations, which could be auditory, they're hearing things, or probably visual, they are seeing things that are not in existence. The course of action that should be taken at that particular time is, number one, to have this patient isolated into a safe environment, more probably into a hospital setup, because while they are suffering from those hallucinations, the visual ones or the auditory ones, they may act in violent ways. They may cause harm to themselves or harm to somebody else. So I think the first line of action is to isolate this person in a safe environment, and most of the times should be in a hospital setup where they are well taken care of, so as they don't harm themselves or harm somebody else. Of course, when in those setups, the hospital setup or in a rehabilitation, then detox should be done, and medicine provided to minimize the hallucinations, because hallucinations is a sign of a psychotic episode. And I'm saying this as a doctor because most of the people will probably say there are other reasons of why this person is shouting. He's been irritated or been annoyed by somebody, but on most occasions, these are real psychotic episodes, they are sicknesses. And if they are prolonged, the episode of talking to self is probably going on for many hours, then there's need to have some medical intervention. Good.
Thank you, Dr. Mburu. Thank you. Zaini, are you there? Zaini, can you hear me?
Yes, I can now. Can I go back to?
Yes, please. You can go back to the question on relationship between mental health and addiction. Yes, please.
Understanding the relationship between mental health and addiction. Okay, so substance use and mental health disorders, as I was saying, such as depression and anxiety, are closely linked up, although one doesn't necessarily directly cause the other. Now, abusing substances such as marijuana or methamphetamines can cause prolonged psychotic reactions, like Tari was saying.
Okay, I think we lost Zaini again. Judy, if we can get back to the next question. It says, what advice do you have for communities that are trying to make substance use a priority? What guidance do you have for them?
Thank you, Shaheena, for this very good question. A community that is concerned about its population's safety and health should be encouraged to continue. And what I would encourage the community to do at first is to do a baseline survey to assess the needs of the specific community, and then identify the priority of the citizens or of the people of that community. We should also refer to the evidence-based programs and approaches to addressing substance use and management in the communities, and now contextualize it in our context, in our own contextual understanding. We should also make it known by the community for acceptability and sustainability purposes. And then we should now include or incorporate professionals to enrich what we already are planning to do. And I would also want to encourage communities to take up community-based programs, if it's rehabilitation programs and they are implemented within the communities, by the community, for the community. This has been seen as a best practice and it really works. So if a community wants to start a rehabilitation program and educate or capacity build some of the professionals within the community to implement the program, this really can last and make an impact within the community. Thank you, Shaheena.
Thank you, Judy, for that. We're heading towards the last question, and I think this one goes to Farid. As a father and a son and a brother, what message do you have for the families out there?
I think make the environment, for the addict and the non-addict, just make it a safe place to have a conversation. I think a lot of the reasons addicts don't admit that they have a problem is because they're afraid of the reaction from family. I sat down with my whole family and explained my addiction when I wanted to get better. And I'm blessed to have a family that, there was no judgment. There was a lot of support. But I would, from my understanding, it's not the case everywhere. So I think just make it a very safe place where that conversation can happen. As I said earlier, around a dinner table, in a living room, at the mosque, anywhere. Just make it a safe place to have that conversation without fear of stigma.
Okay, thank you. Thank you so much, Farid. We've come to the end of our webinar for today. I just want to thank each and every one of you for responding to the questions that the community members have come up with. I'd like to thank Farid for sharing your experience, sharing all the tips that you gave people who are listening to us. Thank you so much for being here. Thank you to Judy from NACADA. It's always so good to hear you and to work with you. Thank you, Dr. Mburu. Thank you for being here today and sharing your expertise. And I'd also like to thank Zaini, our National Board Member for CCS, for being here today. And yes, we've come to the end of our session for today. So thank you all. Thank you all so much. And we have our CCS numbers on the screen. To everyone that's listening out there, that's our CCS contact numbers. Please reach out for anything that you may need. For confidential mental health support, we are here for you. Please reach out to the numbers on your screen. Thank you all. Have a good evening.
Bye. Bye.
Bye.